Hi, my name is Andy Lockey, and I'm here to talk to you today about Restart a Heart, which is an initiative on behalf of the Resuscitation Council UK, but also how closely it links with the aims and the aspirations for the University of Huddersfield and its work with local communities within West Yorkshire. A little bit about myself, first of all. I qualified as a doctor in Leeds in 1991. And for the last 20 years, I've been a consultant in emergency medicine here in West Yorkshire at Calderdale and Huddersfield NHS Trust. And over that time, I've developed an academic career as well, working closely with international organisations like the International Liaison Committee on Resuscitation that formulates guidelines for resuscitation practice. But my academic career particularly culminated during lockdown in 2020 when I undertook a PhD with the University of Huddersfield. And this PhD mainly looked at the use of education with life support training. But as with most PhDs, was more of a journey to help myself understand more about academic practice. I was really honoured and privileged last year to have then been made a visiting professor in emergency medicine at the University of Huddersfield. And I'd really like to thank the university for this prestigious honour. Alongside all of these events, I'm also president of Resuscitation Council UK, and over my time with this organisation, I've developed a keen interest in getting training in CPR out to as many people as possible. So what is my vision? My vision is that everybody knows how to do cardiopulmonary resuscitation, otherwise known as CPR. But in parallel with that, everybody knows the importance of using an automated external defibrillator, otherwise known as an AED. These are basic life-saving skills which anybody can possess, and it only takes two hands to save a life. What do we know about this situation? First of all, we know that every year about 30,000 people have an out-of-hospital sudden cardiac arrest, where their heart just suddenly stops beating. And this may actually be without any symptoms or signs that will predict that it's going to happen. If someone has a sudden cardiac arrest, their outcome is always better if someone starts CPR as soon as possible. But we know that bystander CPR rates really range significantly. Some places very high, some places very, very low. Most people who have a cardiac arrest will have somebody by them. They'll have a witness. In fact, in more than half of the cases, and over 80% of them will actually happen in the home. But countries where there are higher bystander CPR rates have got better survival rates. And on the right, you'll see there the graph at the bottom, which shows Denmark. And critically, 2005, that was the year that they started training every single child in every single school how to do CPR. And you can see that the survival rates have really escalated since 2005. Why is this important? Well, cardiac arrest is not discriminatory in that it can affect all ages and all types of people. So it's vitally important that everybody possesses the skills so that wherever they are, whether they're at home, at work, at the pub, at the mosque, shopping centre, at the train station, wherever they are, they have the skills that they can save the life of the people around them. Because the skills that we've already mentioned, CPR and AED, can all be done even before the ambulance arrives. But most importantly, wherever you are, make sure that the people around you are trained, because you never know, you may be the recipient of that beneficial intervention. Don't leave this until tomorrow, because we never know what's going to happen. Make sure that your life is saved as well as other people's. So how does Restart a Heart play into this? Well, it originally came about in 2012 when a written declaration was passed at the European Parliament calling for all member states, of which we were one at the time, to have an annual awareness date around cardiac arrest and how best to deal with it. Those various pockets of regional activity, including from our own Yorkshire Ambulance Service from 2014 onwards, and myself a member of the British Heart Foundation and a member of Yorkshire Ambulance Service, Jason Carlyon, we presented the Association of Ambulance Chief Executives in 2016 and immediately got unanimous buy-in from all of the chief executives. And from then onwards, every single ambulance service in the UK have been critical partners to deliver Restart a Heart. We've also been supported by key strategic partners, including St John Ambulance, British Heart Foundation, and the British Red Cross. The aim of Restart a Heart was to provide that broader CPR training for as much of the population as possible, whilst also campaigning in parallel for CPR to be on the school curriculum. And as such, we targeted primarily school children. And we were supported, as you can see on the top left, by the footballer Fabrice Muamba, who himself had had a high-profile cardiac arrest. Where are we now with Restart a Heart? Well, nearly 10 years down the line, over 1 million people in the UK have been trained. It truly was an initiative that we set going, knowing that we reap the benefits years later, but we are reaping those benefits. It's now even a worldwide initiative with World Restart a Heart, and we're getting messaging about the importance of CPR and defibrillators to the vast majority of the planet, with over 304 million people reached last year alone. Most importantly, in the UK, our Plan A has been achieved. So CPR and AED awareness are now mandatory components of teaching for every school child in all 4 nations of the UK. So throughout England, Scotland, Northern Ireland and Wales, from this year onwards, all school children are going to be trained, which is fantastic because it's building the skills for generations to come. But we know that there are still needs for people who are older to learn CPR as well. Is it effective? Well, the simple answer is yes. We did an analysis of the Yorkshire results, and between 2014 and 2018, we analysed parts of Yorkshire and West Yorkshire where we had delivered Restart a Heart training every year in those 4 years, and areas where we hadn't delivered the training. And what we actually realised was that the key outcome in terms of bystander CPR rates were much higher in postcode areas where this sort of activity had been trained. So there is an association between Restart a Heart training and increased bystander CPR rates, which in turn would lead on to better survival. But we also looked throughout the UK at where the Restart a Heart events were happening. It was voluntary activity, and there was amazing engagement from all around the country. Most of the activity was done in schools, which is where we were targeting our work. But what we did find was that the areas where Restart a Heart training were being delivered were not necessarily the areas where there was the greatest need. What do I mean by that? Well, we're now looking a bit more closely at health inequality. We're looking at hotspot areas, and by that we define those as a combination of a postcode area where you've got a higher than median chance of having a cardiac arrest, but also a less than median chance of getting bystander CPR. So the perfect storm, really. And Restart a Heart historically has only really trained 28% of known national hotspots. So we don't want to stop delivering this training, and as it's on the curriculum now, that will hopefully be ongoing. But moving forward, we need to now look more critically at the areas where this training is in greatest need. And we know that these areas are more likely to be related to areas of deprivation, social crowding, and also some ethnic communities, and also geographical areas as well, where there may be longer wait times for ambulances. So why are people having higher rates of cardiac arrest? It may be underlying health problems. It may be related to deprivation. Why they're not getting CPR? Multiple factors. It may be lack of knowledge, lack of awareness. It may be that people just can't access training. So we need to find a way of targeting training into these areas, and it will require different interventions. There's not one size that fits all, and there's some ongoing research that's looking around this. So it may be that some communities may have literacy problems. There may be language issues. There may be communities where they maybe don't want to access technology, which may well be able to give the messaging that they need. It may be that they are geographically so far distant from somewhere where they can access training that they may need support with that. So health inequality is a very, very big area, and it's an area that in particular the University of Huddersfield is really interested. So this is the health and wellbeing section of the University of Huddersfield, led by Professor Joanne Garside, and we have great aims over this next few years to really provide for our local communities and throughout West Yorkshire an offer whereby we can get training to those that need it the most. We're looking at how we can get training as part of a mobile clinic to schools, to communities, to community groups and to workplaces, and really target that sort of diversity and really offer better survival rates for our communities. Whilst we maybe can't directly impact upon underlying health conditions in an immediate sense, there's obviously the public health initiatives that can look at that. But what we can do is target where training is most needed and work with those local communities to find the best way that the training can be delivered. And long term, we want to engage not just the students within the healthcare topics of the university, but the broader sector of students within the university as possible. So it's exciting times. We want to help our local communities, but this needs to be evidence and data driven so that we can make sure we're delivering the resources to the most appropriate places, but also underpinning training to the whole community as well. So thank you for listening. First and foremost, if anybody listening to this is not sure of what to do in a cardiac arrest, on the top left of the screen is our CPQR code from Resuscitation Council UK. So just take a picture using a smart device and that will take you to a QR code which will link you to an animation which gives you the simple facts of what to do if you witness somebody having a cardiac arrest. So our ask is basically to you as an individual, but also as a member of a community, maybe as a member of an organisation. Whatever level you want to help, then please help. Look after yourself, look after those around you, learn the principles of CPR and AEDs. Thank you very much.